All right, now that we've overviewed these classifications of joints, we're going to look at them in just a little bit more detail. Now, your fibrous joints and your cartilaginous joints are the least complicated of our categories. So we're going to put these two together and then give our synovial joints their own video because they're a little bit more complicated. And we'll also talk quite a bit about synovial joint movement. So let's begin with these classifications based on structure. Fibrous joints have dense connective tissue that connects bone to bone or bone to tooth. So there's no joint cavity. Most of these joints are either immovable or they only allow just a very, very slight amount of movement. We have three categories of these that are the most common: gomphoses, sutures, and syndesmoses. Now we're going to examine each one of these, so I'm giving you very little detail here in this overview. So we'll begin with our next category, which are the gomphoses. So a gomphosis is found in one place in the human body, and that's a peg in a socket joint. So think about the structure of your teeth and the way that they sit in the mandible and the maxilla. So the articulation is the tooth with the bone of the mandible or the maxilla. So the tooth is actually held in place by what we call a periodontal ligament and periodontal membranes. Now, that holds the tooth in the socket that it sits in. Now, think about when you were a kid and you were pulling your teeth. Do you remember that sound that, your tooth is really loose and it's about to fall out, but it just won't let go yet? And you sit there and you start wiggling and wiggling and wiggling, and you hear that sort of crackly sound, sort of like that. Yeah, well, that was you tearing all of that connective tissue that was holding that tooth in place. Because as we start to lose our baby teeth, we have cells called odontoclast. Well, that should sound familiar to you. Remember, you just learned about osteoclast, breaking down bone? Well, odontoclast will break down the root of the tooth. And that's what allows the tooth to become loose, because we lose all of this root that is actually sitting down in the sockets and holding it in place. But until we completely tear those periodontal ligaments and the membranes that hold it in place, then we can't pull that tooth. So it does function as a synarthrosis. Remember, that means an immovable joint. Another of our immovable joints, but also still fibrous, is found in the skull. So you learned about sutures when you did the skull in lab. So these bones are held together with very, very short connective tissue fibers, and there are rough and irregular interlocking edges that sort of interlock with each other, as you can see here in this close-up view of where the frontal bone meets the parietal bones, and it creates that suture. Now, you should have also learned that these are not ossified in the fetal skull, and these sutures don't fully ossify until we are pretty close to getting to the point that our skull's not going to grow anymore, because once this is ossified, no more growth can occur, right? Okay, so we increase stability because there's no movement between these bones once they are fully ossified. Now, with that increase in stability, of course, that decreases mobility, but you don't want the bones that surround your brain to be moving, so good thing these are made that way, right? All right, now this also decreases the risk of fracture because these bones do not allow for movement. So they function as synarthrosis. They allow for growth of the skull during childhood, but once they fully ossify as synotoses, then there is no more movement. So just think of these as the sutures that don't allow the skull bones to move. Your syndesmoses have interosseous membranes between the bones. Interosseous. Think about what that means. Inter means between, osseous means of bone. So you can see here between the radius and the ulna, which are the lower arm bones, there is a sheet of connective tissue. So this is ligamentous connective tissue that holds the radius and ulna together. The movement, of course, as I mentioned, is amphiarthrotic, which means it is slightly movable, and it helps to provide a pivot point for these long bones. Our second category of structural classification are the cartilaginous joints. So cartilaginous joints are either going to hold bones together by hyaline cartilage, remember that's the one that looks like frosted glass, or fibrocartilage, the very tough fibrous cartilage, right? So these joints are not going to have a joint cavity. Some of them are immovable, some are slightly movable, and these joints are synchondrosis or symphysis. So let's look at some of these, and I just noticed here on the slide I stretched it a little too much. So this ES is the last part of synchondrosis, okay? So you have right here your epiphyseal plate holding the two parts of the long bone together. Okay, do you remember what the epiphyseal plate is composed of? Hyaline cartilage, exactly. You also have the costal cartilage that attaches your ribs. Costal means of the rib, remember? So attaches your ribs to your sternum. You have your intervertebral disc and your pubic symphysis that are fibrocartilaginous joints, okay? So your fibrocartilaginous joints is not going to allow for a whole lot of movement either. So just like we did with the fibrous joints, let's look at these cartilaginous joints individually. So synchondroses are where the bones are joined by hyaline cartilage. As you see right here with the epiphyseal plate in the long bone. Now remember, as long as there is cartilage there, and that is hyaline cartilage, as long as that cartilage is present, that bone can continue to grow in length. Now, your costal cartilage is also made of hyaline cartilage, and this is where the ribs articulate with the cartilage that joins those ribs to the bones of the sternum. Now, these, of course, are immovable joints because we don't want our ribs moving around in our thoracic cavity. Oops, sorry guys, skipped a slide there. All right, so our next category are the symphyses. So your symphyses have pads of fibrocartilage between the bones that articulate. So you've seen these in lab already, so hopefully this will just be a reminder. The pubic symphysis and the intervertebral disc are made of fibrocartilage. Now remember, fibrocartilage is very tough, fibrous cartilage that resists compression. And that allows these bony structures to act sort of like shock absorbers. Now, this allows for a very slight movement, which is important because think about your vertebral column. That's your main supporter of your torso, right? We need a little bit of movement, but not too much. And same thing with the pelvic girdle. That pubic symphysis there will allow for just a little bit of movement in those joints, which is very important during childbirth. We'll look at one quick disorder here associated with cartilage. Now, I always try to teach my students to look at words when you see something new and unfamiliar to you. Look for pieces and parts that are familiar. So let's take this word, costochondritis. Anytime you see itis, what does that tell you? Inflammation. So itis means inflammation. What about chondri? Do you remember what chondrocytes are? Chondrocytes, remember, were cartilage cells. So con or chondri refers to cartilage. So far we've got inflammation of cartilage. Costal, cost refers to rib. So inflammation of the cartilage associated with the ribs. Now, this information causes localized chest pain, as you can see right here where the costal cartilage articulates with the sternum. Now, this usually does not have a known cause, but commonly it is just some sort of trauma or an infection. Now, this can be mistaken for a myocardial infarction, which is the science name, anatomical name, right? Medical name, take your pick, for a heart attack. Okay, so myocardial infarctions are commonly associated with that chest pain. Well, this also causes chest pain in the same area and therefore can, excuse me, can be mistaken for an MI. The most common way to treat this is the same way you treat any inflammatory disorder, and that is with NSAIDs, non-steroidal anti-inflammatory drugs.